I had an example this past week where a patient came in who he and his partner went to an orgy. That was his word. So, sex party, whatever, however you want to describe it. And there was boundaries that were crossed that he was not comfortable with. Like he ended up having feeling like he totally exposed himself to potentially lots of different diseases through having sexual practices that he and his partner did not discuss, or if they discussed those topics, did not actually adhere to those boundaries that they wanted to be set up. And he was really, really upset about that. And so, talking to not just our female patients, but our male patients too, as well, about consent and being like, this is something that within yourself, you need to figure out so that you're able to verbalize that to your partner. And so that, again, going back to this, does this feel good to me? If you're, going to a sex party might feel good, but then stepping across a certain line, where you were having sex with an unprotected sex with a certain partner that you don't feel comfortable with, that is, where where the fun part then translates to the really dark side of the sexual health that we're talking about.
What he's talking about exactly. And I think when we talk to our patients, I think you and I both can agree that we talk to them as we would our children, our kids. We have grown. I have grown kids, and you have growing kids, but who are stepping into that realm of figuring out what sex is going to look like for them.